Pittsburghers of a certain age will remember Richard Caligari, the city of Pittsburgh mayor who steered the community through Renaissance 2 at a time when Pittsburgh was suffering the collapse of its industrial economy. They may remember, too, that Caligari died in office, the victim of a rare disease called amyloidosis. Not long after, Erie Mayor Louis Tullio was diagnosed with the same disease, as was Pennsylvania Governor Bob Casey. In little more than a decade, all three were gone. Amyloidosis was thought to be an extremely rare disease, but it turns out that might not actually be the case. And now Allegheny Health Network, which sponsors this program, is rolling out a new program to improve diagnosis and treatment of amyloidosis. And Dr. Srinivas Murali is co-chair of the Allegheny Health Network Cardiovascular Institute. And welcome, good to have you here.
Happy to be here.
Yeah,
thanks for having me.
I am definitely one of those Pittsburghers of a certain age, as I guess you are too, because you were involved in treating Governor Casey that remembers these stories about amyloidosis, which nobody had ever heard of. I remember at the time that we were all told this is incredibly rare and so unlikely that 3 cases could turn up in western Pennsylvania in the space of 10 years. But it turns out it's not quite as rare as we thought.
Yes, you're absolutely right. I think amyloidosis, relative to other common conditions, is still pretty rare, but it's certainly now getting recognized as a more common disease, and significant progress has been made in understanding this disease, understanding different types of amyloidosis, because not all amyloidosis is one and the same. Okay. And there are some forms of amyloidosis which now it's recognized is more common than we had originally anticipated.
Well, I remember back when Mayor Tullio and Caligari's got it, there was this, it was related to people of Mediterranean descent, and then you had the Irish Catholic governor of Pennsylvania who winds up being diagnosed with the same disease, so that was not necessarily the connection.
No, amyloidosis is a whole spectrum of diseases. The common theme here is a protein that is abnormal. It is not structurally normal, and so there are 2 kinds of amyloidosis. One in which the protein is produced in the bone marrow, and that affects, that is an abnormal protein, and that goes and affects various organs in the body, and it behaves much like a cancer because this protein can spread. It goes wherever the blood takes it, so it will go and affect the heart, the kidney, and other organs, and can be very devastating. And that's the kind of amyloidosis which the mayor of Pittsburgh and the mayor of Erie suffered from. And we now call it AL amyloidosis, where the A stands for amyloidosis and L stands for light chain. Light chain is the protein that is abnormal in that particular condition. And contrast that with the other kind of amyloidosis, which is called ATTR, where the abnormal protein is TTR. And that protein is produced in the liver. And again, it's abnormal, it is structurally abnormal, it goes and it deposits in the other organs and affects it. So ATTR amyloidosis is seen in different ethnic populations. Okay. And the Mediterranean type of ATTR amyloidosis generally affects the nervous system, usually affects the nerves, whereas the Irish background people with ATTR amyloidosis have the protein that predominantly affects the heart.
Fascinating. So, and really, you think about the last 30 years, it's really the increasing understanding of the genome and genetics that's leading to some of the understanding of how this disease works, right?
Yes.
And so is that also helping then in terms of how to identify it earlier and how to treat it once you find it? Yeah,
absolutely. I think we now have new tools to diagnose it. I think that all types of amyloidosis, the diagnostic ability has improved. I think we are now suspecting it more, and we are running the tests more. And the most important progress that has been made, particularly in amyloidosis that affects the heart, is that in the past, the only way to diagnose amyloidosis in the heart was to do what's called a heart biopsy, where you have to, it's a very invasive procedure where you have to go in, take a small piece of the heart muscle,
right out of the heart.
And then send it to a pathologist for analysis. But now we have a non-invasive scan called a PYP scan. It's like an X-ray, and you can pick up amyloidosis just by that technique. So that's been a significant progress in this field.
Well, and so what exactly, I know AHN is really now focusing on this with this new center. What are you going to be doing, and why are you doing this kind of focus?
So the reason we are doing it is because we now know that amyloidosis is more common than we thought. So, and we also know that there are a lot of patients that are either not diagnosed in a timely manner or frankly their diagnosis is missed. In fact, I think there was a recent publication that illustrated this point, and that is, on an average, every patient who has amyloidosis has seen at least 3 doctors before a diagnosis is established, which tells you that this is not an easy thing to diagnose, and so we felt that having a focus in this area was important. And the other key thing, and this resonates with the way Allegheny Health Network has designed its clinical programs, is that amyloidosis is a condition that affects the nervous system, that affects the bloodstream, that affects the heart. So to manage it, you need a specialist from cardiology, you need a specialist from hematology, you need a specialist from neurology. And that's what we have done. We have put a program together that brings in all these expertise into one program, so that allows a patient to navigate through the program and not miss any input necessary from any particular specialist, so that we have a good plan of treatment for the patient.
Wow, wow, exciting to see it happening here in our region, and appropriately as well, I guess,
yes,
given our history. Dr. Srinivas Murali from AHN, thank you both. Thank you so much. Really appreciate it.
Thank you.
Yeah. And we'll be back in a minute with little dollars and cents. To be specific, a $10 founding father. Please stay with us.